Good afternoon and welcome to the Health Shift. I'm Janae Talbot, I'm the Public Relations Director, and today we're going to talk about Colorectal Cancer Month, which we celebrate in March. And today we have a special guest with us, Chastity Thacker, who works in respiratory therapy.
Hi, I'm Chastity. I work in respiratory therapy, and I want to talk about colorectal cancer a little bit. Unfortunately, I recently got diagnosed with rectal cancer at the age of 42. The recommended age of screenings currently is 45. So I just came to bring awareness to let everyone know that at any time you feel like you have any symptoms, please talk to your physicians. I thought I had hemorrhoids for a couple of years and finally went to take care of what I thought was going to be hemorrhoids. And the physician here, you can have your colonoscopies done here at Russell Regional Hospital, which is really convenient. The physician here recommended a colonoscopy along with what I thought was going to be a hemorrhoidectomy because I had some rectal bleeding that I passed off as hemorrhoids for a really long time. So I just want everyone to be aware of their bodies and pay attention to your bodies, listen to your bodies. Because although the recommended age for colonoscopies has dropped from 50 to 45, from what I'm hearing from all of the physicians I'm with, they are seeing an increase in early onset colorectal cancer. The biggest thing I think people just need to be aware of symptoms. If you have any change in your bowel habits, any persistent cramping, pain, change in the shape of your bowel habits, any rectal bleeding or mucus with your bowel habits, those are things to be aware of. Also, any unexplained weight loss. Just be aware of those symptoms and talk to your doctors about them. I think that, as a healthcare professional, sometimes and a young person, we pass off a lot of symptoms that we think, we can take care of that later. And unfortunately, sometimes you really need to pay better attention to your bodies.
So if someone suspects they might have a problem, what would you suggest they do first? Call the physician's clinic or?
I would say talk to your primary care doctor, make an appointment, and talk with your doctor about those symptoms. And they can generally get you in, if they feel like a colonoscopy is recommended, they can get you in. I think Dr. Stiles does the colonoscopies here as well as Dr. Summers. So it's fairly easy to get in for a colonoscopy if you're having symptoms.
And is that something people should have done annually, or does that kind of depend on the situation?
I think that depends on the situation and what your doctor's recommendations are. I know if you have a familial family history of colon cancer, you are supposed to get your screenings done 10 years before the person in your family was diagnosed.
Okay. Okay.
So like for my kids, my symptoms first started probably a couple of years ago. My kids will have to start their screenings at the age of 30.
Right.
So
just some preventative medicine there too.
Definitely.
Yes. So what's your plan now? What's your plan for treatment? And I know you just began, but.
So my plan, I went to MD Anderson in Houston, and my plan is I started my first round of chemo to do systemic chemo and reevaluate. After I have 5 rounds of that, I will go back to Houston to reevaluate and see if I can do surgery and possibly avoid radiation. A lot of times the treatment consists of, depending on where your cancer is located, will consist of radiation with pill chemo in addition to systemic chemo, and then surgery. There is some advancements in some of what they're doing for treatment. Cancer is evolving. It's crazy. It depends on what type of tumor you have and if there's any genetic
disposition.
mutations or anything like that. Sometimes people can get immunotherapy versus chemotherapy.
Okay.
So
If people want to help support you during this season of life, what are some ways that they can help support you?
lots of prayers. I also have an account set up at Southwind Bank. I have a Venmo that they can donate to and a PayPal. We're going to be doing a few different types of fundraisers. I know this Saturday, I think in Dorrance at the Tipsy Bowl, they're doing a free will donation from noon to 5. We have some things coming up, planning. I would say just pay attention to Facebook. The community's been very good to me so far. There is also a meal train that a couple of people that work here with me started that you can sign up for to bring meals to my family. And the community has been very, very good to me, as well as my coworkers here. I'm very blessed to work here, definitely.
And you also have some T-shirts.
Yes, some T-shirts. That shop closed. I know that there, a couple of my friends are going to be doing some more T-shirts, possibly through another print shop here in town. So just be paying attention to that. The T-shirts, I don't know if they'll reopen the first one or not. That was kind of they opened
Just to kind of kick it off.
Yeah, to kind of kick it off. So
Good. Anything else you would like to share with us?
Just really pay attention to your bodies and, get your annual screenings, get your things that your doctors recommend, get your mammograms, get your prostate exams, get your colonoscopies. Honestly, the colonoscopy was not that bad. The prep was a little the worst part of it, but the colonoscopy itself was not that bad. The physicians here are great. Very caring, and I think that you just need to take care of your bodies.
Okay. Well, we certainly wish you the best, and we appreciate you coming on and talking to everyone about this issue. And we certainly wish you all the best.
Thank you very much.
You're going to do great.
Thank you. Thank you. Below, there will be some links that you guys can use to help donate to my fund or whatever.
Meal train.
Meal train.
Yes.
We'll make sure we have those links available for everyone.